Hello everybody, I am Hadil Ad-Dardasawi. Today inshallah in this video I will talk about smoking. The contents: what is the smoking? What are the reasons of smoking? What is the category exposed to smoke? Effect of smoking and its effect on health. The annual death rate from smoking. Effect of smoking on the physiological and psychological and social status. How do people get addiction to smoking, and how to quiet smoking. Now, definition of smoking: smoking, the act of inhaling and exhaling the fumes of burning plant material. Reason of smoking: stress and anxiety, the influence of friends, media effect, parental influence, drug and alcohol abuse, and depression. What is the category exposed to smoking? Adolescent between the age of 13 and 15 years, and school and children in school, maybe as now. Smoking and its effect. Smoking leads to disease and disability and harm nearly every organ of the body. It also negatively affects the psychological, social, physical, and health status of the smoker. Smoking effect on physiological status, such as distance himself from people and increase physiological pressure and depression increase in stress and anxiety. Smoking effect on health status, such as changing the color of gum and teeth, black and dark, tumor of the genitals and other organ, negatively affect the function of the lung, thus impaired breathing, cough, lung cancer, and tracheal infection, a blockage of the artery and blood vessels, and affect negatively affect on nervous system, thus making smoker more nervous and tense, and retina problem, and COPD, eyes problem of immune system, and heart disease. Effect of exposed to smoking on children. Children who are exposed to second hand smoke and at increased risk of sudden infant death, acute respiratory infection, middle ear edema, more severe asthma, respiratory symptom, and slowed lung growth. Now, what are the harmful effects of smoking on pregnant women and infants? In pregnant women, ectopic pregnancy. Ectopic pregnancy means pregnancy outside the uterus, usually in fallopian tube, fetal death, spontaneous abortion, known as miscarriage, premature labor, and premature rupture of the membrane, and the problem with the placenta, such as a blockage in placenta or placenta previa. Smoking effect on the infant or on unborn baby: reduce oxygen supply and nutrition due to CO2 and nicotine in smoke, slower growth and development, impaired development and working of placenta, harming the development of baby's brain and lung, increased risk of birth defect and deformity in fetus. Mortality. In 20th century, 100 million people dead as a result of smoking. Thus, smoking is largest epidemic using death worldwide. The effect of smoking on social status, social stigma and isolation. Smokers feel they are locked down, lack of freedom. Smokers are feeling restricted in their life, feeling that you are not control your life. Smoker feeling unwell, unclean and not fit. The smoking effect on physical and psychological status. Smoking with the stress, with the depression, with anxiety and depression and so on. How do people become addiction? Improve mood and focus, decrease anger and stress, relax muscle, make person feel euphoria, need more nicotine. Ways to help you quit smoking. Prepare for change, get support from family and friends, find other ways to cope with stress, find a local stop smoking service, talk to your doctor for help, avoid triggering smoking, be prepared for withdrawal symptom. Remember the benefit of quiet smoking and don't give up. Thank you.